If you thought the rules for older Australians were settled, think again. What is happening right now to pensions and aged care in this country is the biggest shake-up in decades, and millions of seniors either do not know about it yet or are only getting half the story. Stay with us, because what we are about to share could directly affect your income, your care, and your future. Welcome to Centrelink Brief, your go-to channel for clear, no-nonsense breakdowns of everything Centrelink, pensions, and government support in Australia. If this is your first time here, make sure you hit subscribe so you never miss an update that could affect you or your family. Let us get into it. For years, older Australians navigating the aged care system lived under one set of rules: the Home Care Packages program. You got assessed, you were placed on a waiting list that could stretch for months or even years, and then you received one of 4 funding levels to manage your home care. It was complicated, slow, and often unfair. That system is now gone. On November 1, 2025, the Support at Home program replaced the Home Care Packages program entirely. This is not a minor tweak. This is a full replacement, and if you or someone you love relies on government-funded home care, you need to understand exactly what has changed. My aged care. The first major shift is in how funding levels work. Support at Home has 8 funding classification levels, compared to just 4 under the old system, with annual government funding reaching up to $78,106 at the highest level. That top figure is significant. More people can now access more support, and the funding is tied to your actual assessed care needs rather than a fixed package number. Your needs determine your budget, not the other way around. Superior care. For anyone who was already receiving a home care package when the switch happened, there is reassuring news. Existing clients were automatically transferred, with no loss of services and no need to reapply. The government made sure that no one was left scrambling during the transition. If you were on the old system, you moved across, your services continued, and your provider would have contacted you with the details of what changed for your specific situation. Care about. Now here is something that catches a lot of people off guard: the way fees work has been completely restructured. Under the old home care packages model, providers often charged separately for package management fees, which could eat up anywhere from 30 to 40% of your budget before a single service was even delivered. Under the new capped pricing model, one all-inclusive price covers everything. There are no add-ons or surcharges. That is a major win for consumers. You will know exactly what you are paying for and what the government is contributing on your behalf. Homage. But there is more coming. From July 1, 2026, the Australian government will apply price caps across all support at home services. This means providers will not be able to charge above a government set limit for each service type. All providers will also be required to publish their full price list publicly, meaning families will be able to compare provider pricing transparently for the very first time. If you have ever felt in the dark about what your aged care was actually costing and why, that era is ending. My aged care, superior care. And here is a change that is going to matter enormously for people receiving personal care. From October 1, 2026, personal care services including showering, dressing, and continence care will become fully government-funded under Support at Home, with zero co-contribution required from recipients. Read that again. Services that were previously means-tested and required out-of-pocket contributions from seniors will cost nothing. For full pensioners and those on lower incomes, this is a life-changing development. Superior care. On the clinical care side, the rules are already more generous. Clinical care covering nursing, wound care, physiotherapy, and occupational therapy is already provided at zero cost to the recipient, with no means test applied. It does not matter what your income or assets are. If you need clinical care under Support at Home, the government covers it in full. Homage. For those managing quarterly budgets under the new system, there is also built-in flexibility. Funds are paid quarterly, and you can roll over unspent funds of up to $1,000 or 10% of your quarterly budget, whichever is greater, into the next quarter. This gives people room to breathe rather than feeling pressured to spend everything before the period ends. Care about. Now, let us talk about the big picture: the new Aged Care Act itself. The new Aged Care Act 2024 started on November 1, 2025, and it puts the rights of older people at the center of the aged care system. This is a rights-based framework, which means the law now places legal obligations on providers to treat seniors with dignity, to meet mandatory care standards, and to be accountable for the quality of care they deliver. Mandatory minimum care minutes of 215 per day including 44 registered nurse minutes are now in effect, and a 24-hour registered nurse on-site requirement applies to residential aged care facilities. Australian Government Department of Health Superior Care. For anyone in residential care or considering it for a family member, residents in permanent residential care on or before October 31, 2025 keep their existing fee arrangements unchanged for the entirety of their stay, and full pensioners who paid no fees previously continue to pay nothing. The no worse off principle is built directly into the legislation to protect existing residents from being hit by new cost structures. Superior care. On the age pension itself, the eligibility age remains at 67. The superannuation preservation age of 60 is considered settled policy with no change planned for 2026. Pension rates continue to be indexed twice yearly in March and September to reflect cost of living and wage movements, so rates are regularly reviewed and adjusted to protect your purchasing power. Wealth Lab. The scale of these reforms is enormous, and the detail matters. Whether you are a senior relying on in-home support, a family member navigating aged care for a loved one, or someone planning for retirement, knowing these changes is not optional, it is essential. Thank you for watching Centrelink Brief. If this video helped you understand what is happening with aged care and pensions in Australia, please share it with someone who needs to see it because this information can genuinely make a difference. Like the video, leave your questions in the comments below, and make sure you are subscribed to Centrelink Brief so you are always one step ahead when the rules change. We will see you in the next one.